I think that there's a shift taking place in South Asian culture where when it comes to things like social media and the millennial and younger generation having a willingness to spearhead the movement to talk about mental health.
I would argue that it's, I don't know if it's easier, but I think it's more critical. I think the pandemic has really shown us that, mental health is something that we all struggle with, varying degrees. But I also believe, with widespread media, there's so much stimulus to the mind that a lot of people don't really have an outlet and be able to have conversations addressing mental health is going to be crucial for us all staying well, taking care of one another.
So I think that there's a shift taking place in South Asian culture where when it comes to things like social media and the millennial and younger generation having a willingness to spearhead the movement to talk about mental health. And now things are finally starting to change, and now people are finally starting to talk openly in my community, but there is that gap to bridge between generations, I think. And I think that there is also an increase in people in the brown people in the millennial and younger generation slowly also starting to work in the spaces of therapy to be able to reach their own population and also help to decolonize the aspects of mental health care.
Absolutely, and I think the reason has to do with stigma declining in the last 10 to 20 years. It's because of brave people who have struggled with mental illness who have been willing to talk about it. And people can see that mental illness is not a weakness. It's an illness that's treatable, and we can all get treatment for that.